I'm Dr. Ricardo Navarro, a specialist in elderly care, and I have something important to tell you. It's very likely that what you've been told about how to protect your brain is dangerously incomplete. You see, we all worry about diet, cholesterol, exercise, but what if I told you that the #1 cause of silent strokes might not be on your plate, but in your own bed? Every night, millions of people adopt sleeping positions that seem harmless, but according to recent studies, can reduce the oxygen reaching their brain by up to 38%. We're talking about an increased risk of over 70% from a simple habit that no one has taught you to correct. Do you sometimes feel dizzy when you get up, a tingling in your hands, or that brain fog that many mistake for fatigue or age? These could be the first warning signs. Pay close attention, because this affects you directly. In the next few minutes, I'm going to reveal the 5 most dangerous sleeping positions, from those that seem harmless to one that Harvard scientists consider a real-time bomb for your brain. This is not an exaggeration. So I ask you directly, what is your usual sleeping position? Have you ever woken up with a numb arm or leg without knowing why? The answer you'll find in this video is one of the most important health lessons you'll ever receive. Stay with me, because understanding this can literally save you. Let's get to it. You know that habit of sleeping on your back, but with one hand under the pillow, as if you were hugging it? Well, be careful with that. It seems silly, but when you do that, your own body weight creates uneven pressure that messes with the subclavian artery. This generates turbulent blood flow, like a rough river, which is the perfect scenario for small clots to form. To give you an idea, it's like stepping on a garden hose, but inside your body. Let me tell you the story of Carmen Lopez, a 58-year-old woman full of life. She started feeling a strange weakness in her hand and headaches that everyone attributed to age-related issues. The truth is that she was suffering from micro-strokes because of this sleeping posture, night after night. Her case teaches us a vital lesson. The body sends us signals, but sometimes the real culprit is a silent habit we consider harmless. How crazy is that? Now, let's talk about another position that looks like something out of a contortionist movie, but that many people adopt: sleeping on your stomach with your head turned completely to one side. By doing this, you are basically stretching the carotid artery on one side and compressing the one on the other for hours. This not only weakens the walls of your arteries, but also makes it easier for fatty plaques to build up. A study from the University of Michigan revealed something that will freeze you. This posture ages your blood vessels by the equivalent of 10 years. Imagine Julio Fernandez, only 47 years old, who started seeing flashes of light, as if a picture was suddenly being taken of him. The diagnosis was amaurosis fugax. The cause? The narrowing of his left carotid artery, the very side he always turned his head to when sleeping. His body was screaming at him to stop. If these postures, which aren't even the most common ones, are already this dangerous, hold on, because what I'm about to tell you now about the ones almost all of us use will surprise you even more. Brace yourself, because now we're moving on to one that is probably yours. Sleeping on your side with your arm bent under your head, as if it were your own pillow. A classic. The problem is that your head is heavy, very heavy. That constant pressure compresses the nerves of the brachial plexus and reduces the blood flow going to your brain. A Stanford study recorded up to 43 episodes of cerebral blood flow dips per night in those who sleep this way. It's as if your brain spends the night having micro blackouts. Think of Teresa Aguilar, a 63-year-old retired nurse. Who better than her to know about health? Well, she started having memory problems and a brain fog she couldn't understand. The cause was this chronic postural hypoxia, all because of how she slept. The solution, luckily, is simple. Invest in a good anatomical pillow that fills the space well and learn the quarter-turn technique, which is to lean back just a little to free up your shoulder. Now let's move on to the champion of twists, the one I call the pretzel posture. It's that one where you sleep on your side, but with one leg crossed over the other, twisting your spine. When you do this, you're pinching the vertebral arteries, which are responsible for carrying no less than 20% of the blood to your brain. It's like trying to drink from a bent straw. The flow becomes turbulent and again, the risk of clots skyrockets. The case of Tomas Andrade, 55, is a brutal example of this. He suffered a stroke right in the posterior circulation of the brain, the area supplied by these arteries. It's no coincidence. But don't panic, the solution is to become an architect of your bed. Place a pillow between your knees and another supporting your waist to keep your spine straight as an arrow. We've seen less obvious and very common dangers, but I still haven't told you about the real queen, the one that leads the danger ranking. And we arrive at the crown jewel, the position that takes the prize for the most dangerous of all. The fetal position with the chin completely tucked into the chest. I know it sounds like a comfortable, almost sanctuary-like posture, but it's a real death trap for your brain. Why? Because you create a double blockage. On one hand, you compress the carotid arteries, reducing blood inflow, and on the other, you crush the jugular veins, preventing its outflow. It's literally creating a circulatory traffic jam inside your skull. If you think I'm exaggerating, listen to what the Harvard Medical School, which knows a thing or two about this, discovered. People who sleep like this have an 11 times higher risk of suffering a stroke. 11 times. And as if that weren't enough, the study revealed that 92% of the elderly who adopted this posture already had silent brain infarctions, small scars on the brain that hadn't shown themselves. Yet, the data is enough to make you tremble. The story of Ricardo Salazar, 68, is the human face of these statistics. He arrived at the hospital with an acute stroke, but when the doctors saw his scans, they were stunned. His brain was full of old lesions, marks of small strokes he had been accumulating for years without knowing it. His habit of sleeping curled up in a ball, seeking comfort, cost him the highest price. Every night, without realizing it, he was playing Russian roulette with his brain health. But we're not just here to scare you, but to provide clear solutions. To avoid this silent catastrophe, the solution is surprisingly simple. Use a soft cervical collar at night, the real soft kind, don't worry, and hug a body pillow. The collar will prevent you from flexing your neck too much, and the long pillow will force you to keep your body more stretched out. Now you have the complete map, from the seemingly harmless postures to the most lethal of all, and you know how to protect yourself. Now you know. The knowledge you have just received is not a mere curiosity. It is a powerful tool. You hold in your hands the map of a danger that lives in your own bed, a silent enemy, against which you now have the weapons to fight. You have learned that a gesture as simple as placing a pillow or stretching a leg can be the difference between a healthy brain and a silent catastrophe. But let me be very clear. Knowledge without action is absolutely useless. None of this matters if tonight, out of sheer habit, you go back to adopting that posture that is harming you. Inertia is the enemy of health. That's why I want you to ask yourself a question and answer it with complete sincerity in the comments. Which of these 5 postures is yours? Acknowledging it is the first step to changing it. And now, the most important question. Are you going to continue being a victim of your nightly habits? Or are you going to take control and turn your hours of sleep into a repair and protection workshop for your brain? Your future health is being decided right now in the decisions you make today. Are you ready to make the right choice? If this video has opened your eyes and you want to continue to delve deeper into how to protect your body in ways no one else tells you, do 2 things right now. Subscribe to the channel and activate the notification bell. There is a whole universe of hidden health that I want to share with you. Take good care of yourself and above all, sleep well.